don't believe everything on the internet, because when people talk about sliding genioplasty being the only option, that is not necessarily true. What's up, everyone? Welcome to this week's Sagar Says, where I'm going to be talking about the differences between a silicone chin implant and a sliding genioplasty. Now, this video is for anyone considering anything to make their chin bigger or perhaps smaller, and whether it's something where you're deciding whether you want to get chin filler or a chin implant or a genioplasty. This is a good video to watch before you even begin, starting with consultations and meeting different surgeons. Now, first, let's talk about what is each and what's the purpose of this procedure. So in general, what we're talking about is chin augmentation, augmenting the bony contours of the lower portion of your face. And in regards to that, there's different alternatives. The first is going to be using soft tissue or volumizing augmentation using hyaluronic acid-based fillers. You can also use calcium hydroxyapatite, but for the most part, the most common is going to be a filler like Voluma or Restylane Lift, where we're injecting it into the chin to create volume. Now let's talk about advantages and disadvantages. The first is the advantage. It's almost zero downtime, instant results, and complete precision and control to allow for excellent customization. The downsides, well, there's two of them. Number one is that it's not permanent. Typically, filler will last about 2 years and it slowly dissipates over time. So it's not like 2 years later, you Cinderella and at midnight everything disappears. So you have to keep repeating it. That leads to the second downside, which is essentially going to be cost. When you talk about doing this repeatedly over time, you're going to definitely be spending more than you would with the other treatments. And in regards to that, it's also important to determine how much of a change you're looking for. If it's just a little bit of enhancement, then filler is a great option because you don't need to use an entire syringe even. But if you really have a baseline deficit in that area that's compounded by, your entire jaw position, a little bit of filler is not going to do anything, and needing a lot is really going to add up to being more expensive than having done one of the alternative options in the first place. Now let's talk about the other two options. So the first is a silicone chin implant. If you want to hear more about just exactly what that is, what it's like, downtime, cost, recovery, check out this video above. But for the most part, this is when we make a little incision either inside their mouth or under the chin and insert a prefabricated silicone implant on top of the bone. This is a procedure that can be done under local anesthesia with a downtime of about 5 to 10 days, and it results essentially right after that. There's a lot of different styles of implants, a lot of different sizes, and so there is a lot of expertise required in finding the right surgeon who really knows all the tips and tricks and tools involved. Now, the last option is something called a sliding genioplasty. This is an option that's typically performed by a different type of surgeon than surgeons who do straight up cosmetic surgery. And that's why there's not as much information about this procedure online, despite the fact that when you read online blogs, you'll find a lot of patients loving the procedure or recommending it more than anything else. Now let's break down biases and talk about each of the procedures separately. So when it comes down to it, there is going to be specific people who should consider a genioplasty over an implant and vice versa. The first thing I'll tell you is don't believe everything on the internet, because when people talk about sliding genioplasty being the only option, that is not necessarily true. Sometimes you can go with a simple implant and get the results you're looking for. And sometimes that's what it comes down to. If you're looking for an improvement, an implant can nearly almost provide that improvement for you, especially when done properly in the right hands of the right surgeon. There are times, which I'll show you examples of, where a genioplasty is going to be much better. Now, the first thing is, let's talk a little bit about what a sliding genioplasty is. And this is the part where you'll kind of understand the first key difference. So sliding genioplasty, you're not inserting anything other than screws and plates. What's essentially happening is your surgeon, who's typically going to be an oromaxillofacial surgeon. This is someone who's gone through dental school and then medical school and then residency and combined and done all of it and really understands the mouth more than anything, is going to be able to make an incision on the inside of your mouth. From there, the skin underneath over the chin and on top of the bone is all elevated to the very edge underneath, and a bony cut is made. Various styles and types of bony cuts can be made depending on the goals and what the surgeon wants to do. But in these situations, we can reduce the chin, increase the size of the chin, and adjust it in all 3 dimensions in a custom manner. So if you're looking for mainly vertical height and minimal projection, that's possible. And when we get to it in a silicone chin implant, because you're going prefabricated, you really can't customize it in that dimension. So you can actually reduce it in one dimension and increase it in another one, whereas with no other procedure can you do that. Now, what is happening, however, is a cut with a saw is being made through your bone, and then multiple drill holes are placed to place a titanium plate and titanium screws to bring it into a position. There's a lot of artistry that goes into it, and going to someone who really does a lot of this is recommended. And that's why I typically recommend going to an oral maxillofacial surgeon for consultation to determine this. This does not change the position of your teeth. And so a lot of dentists, not oral maxillofacial surgeons, will say you can get an improvement by just moving the teeth, and that's not necessarily true. What you're really looking for is to change that area. Now, one thing to look out for with a chin implant and a genioplasty in general is what is bothering you. The vast majority of people don't come to a surgeon saying, my chin is what I don't like. Rather, it's I don't like this area underneath my chin. Will doing a chin provide improvement? And sometimes with the neck, it's not just about the chin. It can also be about fat, muscle, deep fat, and it's important to assess those at the same time. Likewise, you can check out this video I made on the anatomy of the chin in order to determine what kind of a candidate you'd be and what we as surgeons look for in your chin and neck to determine what kind of results you can get. Now, back to genioplasty. Obviously, when we're cutting through bone, no numbing medication is going to stop that pain and discomfort. It's highly recommended that you go to sleep. In fact, you usually might even need to stay in a hospital overnight after the surgery. But I've never heard of anyone doing this even with twilight anesthesia. Generally, it needs to be done with you asleep for safest results, getting your blood pressure down, decreasing the bleeding. The recovery time is also going to be a lot longer with more pain, more swelling, but like I said, a lot more customization is available. In regards to cost, you're really looking at a higher cost. If you look at RealSelf, for example, the average cost of a genioplasty is $7,725 in 2022. Now, typically that cost is not going to include anesthesia costs, facility fees, and your overnight hospital stay. And so there's some variability in that. Now, when we're talking about a chin implant, the average cost is going to be $4,950, which isn't that much considerably more. However, that can be done under local anesthesia as I do it, and that is your baseline cost. Okay, so in general, the costs are definitely going to be less, the downtime is going to be less, but for the most part, what's going to be different is what kind of results you can obtain. In general, I would say with a chin implant, the maximum projection you can get is 1.2 centimeters, and that's with the biggest implant of the biggest style. The average implant's giving you anywhere from 6 to 8 millimeters of projection, and the width, the shape are going to be based on the style of implant that's chosen. Now, with a chin implant, the biggest advantage other than downtime and cost is really going to be for those patients who have what I would consider a standard weak chin. Something that when you look around you, you say, oh yeah, that person has a chin similar to mine, and there's going to be a lot of people who have similar chins. It's also going to augment in all dimensions. So if your chin is long but set back, you're not going to be able to make it shorter. In general, there's ways where we can change some of those dimensions, and that's would be with a custom chin implant, where a CAT scan is done and a implant is designed using software in collaboration with your surgeon, and then that custom implant is inserted, and this allows us to get more vertical height, more width, a different shape, and more importantly, even it out. This can be combined with lateral implants to get a whole jawline implant, but once again, this adds up to the cost, and you're looking at a similar cost to genioplasty, so it really is determined by the person. If you have a significant asymmetry, even in the best of hands, a genioplasty is going to have a tough time really correcting that significant asymmetry, and sometimes a custom implant, if you're looking for augmentation in all 3 dimensions, might be your best option. But if you're just a little bit set back, it's a moderate change you're looking for, then oftentimes a silicone implant can improve that. Now, that being said, the last thing to talk about of advantage of a chin implant goes down to the type of provider doing it. Aesthetic providers like myself typically prefer the silicone chin implant, and that's where our expertise lies. Oftentimes, more than not, an implant needs to be accompanied with something like liposuction or platysmoplasty to tighten the under neck muscles. And we are the experts in that, and so that's where an implant can be combined with other procedures better than a genioplasty, as most facial plastic surgeons aren't experts in the genioplasty procedure itself. Hopefully that answers all your questions about cost of a chin implant, cost of a sliding genioplasty, downtime of each of those, recovery. If you would like to set up a consultation to learn if you're a candidate for a silicone chin implant, please reach out to our office. Don't forget to like, don't forget to subscribe, leave any comments below and on what content you'd like to hear, and look forward to meeting you soon.